We're following breaking news. CNN has just confirmed a whistleblower for the Department of Health and Human Services reported U.S. workers who assisted coronavirus evacuees from Wuhan, China, did not have proper training or protective gear. Let's discuss this and more with our medical and political experts. Eric Ding, you're an epidemiologist at the Harvard School of Public Health. What do you think of this report? We confirm the Washington Post report.
Yeah, it's very troublesome because we know this virus is just so infectious. You know, if you go back to the cruise ship, a Japanese quarantine officer, fully geared, went on the ship, came back off the ship, and was diagnosed with this virus, and he was fully protected. To have two health workers go onto that plane with known positive cases and have no protection is just gross misconduct and irresponsible.
Well, tell us also about this very disturbing development out in California, where CDC officials now say they have confirmed the first known what's called community spread of the coronavirus here in the United States.
Yeah, it's very troublesome because this is the first case in the United States in which this person had no travel to China, nor had any contact with people in China. It is an unknown origin, and we believe it's a first canary in the coal mine sign that it's spreading in the communities. But the problem is we have almost no testing. We've only had less than 500 tests in the whole country. South Korea has 40,000. And that's why we're kind of driving in the dark with no headlights without any sufficient testing.
It's so disturbing when we hear these developments, Gloria, especially now this whistleblower complaint, a formal complaint by a respected, highly regarded official of the Department of Health and Human Services who's saying that the U.S. sent these people in there without protective gear.
Well, look, I think it's a real problem, and I think what the American public wants to hear from the government right now. And by the way, in this kind of a crisis, the American public generally believes what the government is telling you. They want to believe you. What they want to hear from is the scientists. They need to hear from the scientists like Tony Fauci, who, according to the New York Times, may be kind of muzzled by the administration. He can't speak unless he's allowed to, and he is somebody who's spoken on infectious diseases for decades and decades.
A regular guest on our program.
Right. They don't want to hear from the politicians right now. They want to hear from the scientists to know what is being done, what needs to be done, what we're missing, such as the testing, for example, absolutely, and what they can do to protect themselves instead of getting platitudes, which the president delivered yesterday, which was everything is great. We don't think it's going to spread here, but if it does, we're ready.
I mean, at least, you know, to give the president some credit, I think what he was trying to project is that America's health and scientific community is prepared, that we have a lot of means. I think that is good information. People do want and need to know that. But I agree with you. What we need is information. As a citizen, I want the government to be working at the federal level in a united way, because only the government has the scale and the ability, Eric, as you were saying, to quarantine and to get this testing up and going. That's what's so important. I cannot urge the political class enough to step back from accusations of weaponizing information and trying to make the president look bad. Everybody has got to be rooting for our government to be organized, to be transparent, and to clear the way, to make sure that what the health and scientific community needs, it gets, and at the same time that we communicate really effectively with people in my own family. My kids are asking me, what do I need to know about this? You know, there's a lot of misinformation, and in the age of social media, boy, that fear can spread.
Well, what do you think about this effort now to control the messaging and prevent people like Dr. Anthony Fauci, who's in charge of infectious diseases at NIH, from going out?
I think it's a really bad idea. I think that, look, Tony Fauci is somebody we both have known, all of us have known for decades, leading combatant in the health community of even the HIV virus and AIDS, so he's an expert. And when he speaks, people not only listen, but they are reassured. You want him to do that. I don't like the idea that the administration would try to shut those people down. I think it's a good thing, frankly, that the vice president is tasked with this effort, because he's got proximity to power to the president and the organizational abilities. But let's make sure we lead with our health and scientific community.
Yeah, the CDC and NIH should be able to stand on its own. There are scientific bodies, public health scientists, people who know how to contain and control this epidemic. They need to have an independent voice that's not muzzled.
You heard the president say yesterday last night that he doesn't regret cutting the funding for the CDC and NIH.
Yeah, that's very unfortunate. And right now we need more than just a $2.5 billion requisition. We need probably 10x that, because the number of scale of testing that we need to do to fully capture and stop this virus is on an order of magnitude this country has not seen before.
And this is where the funding cut hurts.
Yes.
Because if you had the funding, one could argue that you might have had more of those testing kits, that you might have been more prepared for something like this. Now, I'm not saying that we can't get prepared. Our public health community is amazing, as you know, and they can only work so hard and do so much in a limited period of time. And don't forget, the president was saying initially that this is a seasonal issue and that it would all go away by the spring. I hope he's right, but the public health officials are saying not so much. We just don't
And by
know.
the way, the CDC just put out a statement saying that because of this one case out in California of what's called this community spread of the virus, they're now changing the criteria for testing, which is going to be a whole big deal.